My husband suffered a stroke in May of this year, so they put him on like losartan and amlodipine and a statin, but and he's doing okay physically. He started exercising, and he's pretty good in that area. I mean, he has some issues with balance and stuff, but mentally, he's been suffering some cognitive issues like brain fog and maybe like short-term memory and things like trying to find words to explain himself. And I'm wondering, is there anything I could do or something, supplements or something that just to encourage his recovery?
There are some things that you can try.
Okay.
So one of the things is fairly high dose resveratrol, about 1,000 milligrams a day of resveratrol. The resveratrol has an impact on the lining of the arteries, the blood vessels, makes it smoother and improves blood flow to the brain. So even the microcirculation, the tiny, tiny vessels to the area of the brain that have been damaged, he gets a little better blood flow to those. And that, of course, helps with healing and repair. There are some things that can be done, like n-acetylcysteine, which seems to help mitochondrial function, the energy producers within the cells, to allow those to function somewhat better. Coenzyme Q10, up around 300 or 400 milligrams a day of that. These are reasonable things to try. They're more, general nostrums to improve blood flow and cellular health overall. But the brain is a part of the body. So things we do that are good for the heart are good for the brain. So that's why we give these things a shot. Physical activity is going to be important for him. It's really kind of interesting. There is a hormone called brain-derived neurotrophic factors that actually allow brain cells, nerve cells to heal and grow and repair. And the name is a little bit misleading. It says brain-derived because when the researchers discovered it decades ago, they found it in the brains of animals, all right? So they call it brain-derived neurotrophic factors. It turns out that the single biggest source of brain-derived neurotrophic factors is muscle, working muscle. So the more muscle he's got, the more vigorously and frequently he works that muscle, the more brain-derived neurotrophic factors that he will produce to help heal and repair his damaged brain. With a stroke, muscle control is often impaired, and that makes exercise difficult. And especially if he's suffering from depression and cognitive issues with it. But you need to try to get him as physically active as you possibly can that is consistent with safety. We don't want him falling downstairs and hurting himself.